One of the most important and often misunderstood areas where Eastern traditions meet modern psychotherapy is trauma. Meditative practices have long been praised for their calming and clarifying effects. In many Eastern traditions, sustained attention to breath, bodily sensations, or awareness itself is seen as a path toward liberation from suffering. From this perspective, suffering arises because the mind is entangled in past and future, clinging and aversion. Meditation offers a way out. However, modern trauma research complicates this picture. Trauma is not simply distressing memory. It is a disruption of the nervous system's capacity to regulate arousal and safety. Traumatic experiences overwhelm the organism's ability to process threat, leaving fragments of experience, sensations, emotions, impulses unintegrated. When individuals with unresolved trauma engage in meditation too early or without sufficient support, increased awareness can amplify distress rather than relieve it. Turning attention inward may bring up intrusive memories, dissociation, panic, or emotional flooding. This does not mean that meditation is harmful. It means that awareness without safety can be destabilizing. Here, modern psychotherapy contributes something essential: an understanding of timing. Trauma-informed approaches emphasize stabilization before exploration, safety before insight, regulation before deep awareness. Eastern traditions historically assumed long-term communal containment, ritual structure, and teacher guidance, contexts that buffered practitioners against overwhelming experiences. When these practices are transplanted into modern, often isolated lives, something crucial can be lost. The integration of meditation into psychotherapy therefore requires discernment. Awareness is powerful, but power without pacing can harm. Modern clinicians increasingly emphasize titrated awareness, small, manageable doses of attention that respect the nervous system's limits. In this way, psychotherapy does not reject Eastern wisdom, but refines its application. Another profound meeting point lies between Zen philosophy and existential psychotherapy. Zen Buddhism does not offer comforting narratives about the meaning of life. Instead, it confronts impermanence, emptiness, and the limits of conceptual thinking. The famous Zen question, "What was your original face before your parents were born?" resists rational answers. Its purpose is not explanation, but awakening. Existential psychotherapy, developed by thinkers such as Viktor Frankl, Rollo May, and Irvin Yalom, echoes this confrontation. It addresses ultimate concerns: death, freedom, isolation, and meaninglessness. Rather than pathologizing existential anxiety, it treats it as a natural response to the human condition. Frankl, deeply influenced by both Western philosophy and Eastern thought, argued that suffering becomes unbearable not because of pain itself, but because of the absence of meaning. Meaning, however, cannot be imposed. It must be discovered, often through responsibility, values, and engagement with life. Zen and existential therapy converge in their refusal to provide easy answers. Both suggest that psychological maturity involves tolerating uncertainty and ambiguity. Healing does not always mean resolving tension, but learning to live honestly within it. In clinical practice, this perspective can be deeply liberating. Clients are not asked to eliminate anxiety entirely, but to understand its existential roots. Anxiety becomes not a malfunction, but a signal of aliveness. Here, Eastern and Western traditions meet, not in technique, but in attitude, an uvajina for the depth of human existence. While Eastern traditions emphasize awareness and insight, modern psychotherapy has contributed a deep understanding of relationship. Attachment theory, developed by John Bowlby and expanded by Mary Ainsworth and later researchers, demonstrates that emotional regulation is fundamentally relational. Humans learn to calm themselves through being calmed by others. Safety is not merely internal, it is co-created. At first glance, this relational emphasis seems at odds with Eastern ideals of self-transcendence and non-attachment. However, this is a misunderstanding rooted in translation. In Buddhism, non-attachment does not mean detachment or emotional coldness. It means freedom from clinging. Compassion and loving kindness are central practices. The ideal practitioner is not isolated, but deeply attuned to others' suffering. Modern psychotherapy reframes this insight developmentally. Before one can release attachment, one must first experience secure attachment. Non-clinging cannot emerge where there was never safety to begin with. This has important clinical implications. Encouraging detachment or acceptance without addressing relational wounds can lead to spiritual bypassing, using spiritual ideas to avoid emotional pain. True integration recognizes a sequence: relationship before transcendence, safety before letting go. As Eastern concepts enter Western therapy spaces, a critical question arises. How do we distinguish spiritual experience from psychological distress? Meditative states can include altered perceptions, ego dissolution, and intense emotional experiences. In some spiritual traditions, these are interpreted as signs of progress. In clinical contexts, similar experiences may indicate dissociation, psychosis, or destabilization. Without careful assessment, the line between growth and pathology can blur. Modern psychotherapy provides diagnostic frameworks, not to label, but to protect. It emphasizes grounding, reality testing, and integration. Eastern traditions, when interpreted without cultural context, can romanticize experiences that are actually destabilizing. Integration, therefore, requires humility. Not every unusual experience is enlightenment. Not every sense of emptiness is liberation. Sometimes emptiness is depression. Sometimes detachment is dissociation. A mature integration respects both spiritual depth and psychological safety. Consider a fictional but representative example. A woman in her late 30s seeks therapy for chronic anxiety and emotional numbness. She has practiced mindfulness meditation for several years. On the surface, she appears calm and insightful. She speaks fluently about impermanence and acceptance, yet her relationships are distant. She avoids conflict. She struggles to feel joy. In therapy, it becomes clear that mindfulness has helped her tolerate distress, but also allowed her to bypass grief from early attachment trauma. Awareness has replaced contact. A trauma-informed, integrative approach invites her not to meditate away discomfort, but to gently feel it within a relational container. Over time, she learns that compassion is not only something she directs inward, but something she allows to reach her from others. Here, Eastern practice is not rejected, it is deepened. Meditation becomes a support, not a shield. What emerges from this dialogue is not a unified system, but an ethic that values awareness without abandoning relationship, insight without bypassing pain, compassion without denying boundaries, change without coercion. Eastern traditions remind psychotherapy that not everything can be fixed, controlled, or explained. Some suffering must be met with presence rather than intervention. Modern psychotherapy reminds Eastern practice that not all suffering dissolves through awareness alone. Some wounds require relationship, time, and repair. Integration is therefore not a technical task, but a moral one. It asks, what does this person need now? Safety or insight? Containment or expansion? The meeting of Eastern traditions and modern psychotherapy does not offer a final answer to human suffering. It offers something more honest, a way of holding complexity. Suffering's not one-dimensional, neither's healing. When awareness and relationship, insight and safety, tradition and science are allowed to inform one another, psychotherapy becomes not only a method of treatment, but a form of care that respects the full depth of being human. As Eastern contemplative practices increasingly enter Western psychotherapy, a crucial ethical question arises. What happens when wisdom travels across cultural boundaries? Eastern traditions such as Buddhism, Taoism, and yoga did not develop as therapeutic techniques. They emerged within rich ethical, communal, and spiritual frameworks. Practices like meditation were embedded in moral teachings, long-term guidance, and shared worldviews. When these practices are extracted and reframed as tools for symptom reduction, something subtle but important can be lost. Modern psychotherapy, guided by ethical codes, must therefore ask, are these practices being used responsibly? Are they adapted with sensitivity to psychological vulnerability? Are they presented as optional supports rather than universal solutions? Ethical integration requires acknowledging origins without idealization. It means respecting tradition without romanticizing it. And it means recognizing that techniques alone do not carry wisdom. Context does. This is especially important when working with individuals who are emotionally fragile, traumatized, or searching for meaning. Spiritual language can heal, but it can also confuse or pressure. Ethical care prioritizes the client's lived reality over theoretical elegance. One of the most profound influences Eastern traditions have had on psychotherapy is not methodological, but attitudinal. In many contemplative traditions, the teacher does not fix the student. Instead, the teacher embodies presence, patience, and non-reactivity. Insight emerges not through instruction alone, but through relationship and example. Modern psychotherapy has increasingly moved in this direction. Contemporary relational and psychodynamic approaches emphasize the therapist's presence as a healing factor. Research consistently shows that the therapeutic relationship, not technique alone, predicts outcome. Here, Eastern philosophy and psychotherapy converge on a quiet truth. Healing often occurs when suffering is witnessed without judgment. The therapist becomes less an expert who corrects and more a human who accompanies. This does not mean passivity. It means attuned engagement, responding rather than directing. In this sense, the therapist's nervous system becomes part of the therapeutic process. Calm presence regulates, consistency reassures, non-defensiveness invites trust. This is not something that can be manualized. It is cultivated over time through self-awareness, supervision, and often personal contemplative practice. The dialogue between Eastern traditions and psychotherapy has given rise to several contemporary approaches that explicitly integrate both worlds. Developed by Zindel Siegel, Mark Williams, and John Teasdale, MBCT combines cognitive therapy with mindfulness practices inspired by Buddhism. It is particularly effective in preventing depressive relapse by helping individuals relate differently to negative thoughts. The emphasis is not on changing thoughts, but on recognizing them as transient mental events. ACT draws heavily on mindfulness and values-based action. Rather than symptom elimination, it focuses on psychological flexibility, the capacity to remain open to experience while acting in accordance with one's values. ACT's concept of cognitive diffusion closely mirrors Eastern practices of non-identification with thought. Developed by Paul Gilbert, CFT integrates evolutionary psychology, attachment theory, and Buddhist compassion practices. It is particularly effective for individuals struggling with shame and self-criticism. Here, Eastern compassion is translated into a language that addresses modern psychological wounds. These approaches demonstrate that integration can be both respectful and empirically grounded when done thoughtfully. A critical tension remains. When does integration become appropriation? Cultural appropriation occurs when practices are taken out of context, stripped of meaning, and repackaged without acknowledgement or respect. This risk is real, particularly in wellness industries that commodify mindfulness as a productivity tool. Psychotherapy must resist this trend. Respectful translation involves acknowledging origins, adapting practices with humility, avoiding claims of universality, remaining open to critique. Eastern traditions themselves are not static. They have evolved across centuries and cultures. Integration, when done ethically, can be seen not as theft, but as dialogue, provided it remains grounded in care rather than convenience. Not everything integrates smoothly. Some Eastern metaphysical assumptions, such as karma or rebirth, do not align with secular therapeutic frameworks. Some Western emphases on individual autonomy conflict with collectivist worldviews. These differences need not be resolved. Mature integration accepts limits. It does not force coherence where none exists. Instead, it allows different perspectives to coexist, informing practice without collapsing into one another. Psychotherapy does not need to become spiritual. Eastern traditions do not need to become clinical. Their meeting point is not ideology, but compassion. Across this essay, a quiet theme has emerged. Human suffering is not merely a problem to be solved. It is a condition to be understood, a reality to be met. Eastern traditions teach awareness, impermanence, and compassion. Modern psychotherapy teaches safety, relationship, and integration. Together, they suggest a shift from fixing to relating, from control to understanding, from isolation to connection. Healing becomes less about eliminating pain and more about changing one's relationship to it, within oneself and with others. The convergence of Eastern traditions and modern psychotherapy is not a finished project. It is an evolving conversation. It asks therapists, scholars, and practitioners to remain curious rather than certain, to hold knowledge lightly, to listen across differences. At its best, this integration honors both ancient wisdom and modern science, not by blending them into sameness, but by allowing each to illuminate the other. And perhaps this is the deepest lesson they share. Suffering less often comes from having the right answers. It comes from being met with understanding, presence, and care.